The female reproductive system is a complex network of organs working together. This system is responsible for producing eggs, carrying a pregnancy, and giving birth. It also plays a vital role in hormone production, influencing a woman's overall health. From puberty to menopause, the female reproductive system undergoes a series of transformations. These changes are driven by hormones like estrogen and progesterone. These hormones orchestrate the menstrual cycle, preparing the body for potential pregnancy each month. Beyond reproduction, the female reproductive system impacts bone density, cardiovascular health, and emotional well-being. Recognizing the influence of this system underscores the importance of maintaining its health. In the following sections, we will delve deeper into the intricacies of the female reproductive system. Knowledge is power, and understanding the female reproductive system empowers women to take charge of their health.
The female reproductive system is an intricate network of both internal and external structures. Let's take a closer look at these individual components and their specific roles. The journey begins with the ovaries, two almond-shaped organs located on either side of the uterus. The ovaries are responsible for producing eggs through a process called ovulation. They are also the primary production site for estrogen and progesterone. Next, we have the fallopian tubes, thin structures that act as pathways connecting the ovaries to the uterus. Fertilization, the union of egg and sperm, occurs within the fallopian tube. The uterus, often referred to as the womb, is a pear-shaped organ with muscular walls. Its lining, the endometrium, thickens each month to prepare for a potential pregnancy. Leading from the uterus is the cervix, a narrow opening that connects the uterus to the vagina. The cervix acts as a gateway, remaining closed during pregnancy to protect the developing fetus. Finally, the vagina, a muscular canal, serves as the passageway for menstrual flow, sexual intercourse, and childbirth. The vulva, comprising the external genitalia, protects the vaginal opening and plays a role in sexual stimulation.
The journey from fertilization to childbirth is a testament to the capabilities of the female body. This intricate process, known as gestation, involves a complex interplay of hormones and physical adaptations. It all begins with fertilization, the union of a sperm cell and an egg cell, typically occurring in the fallopian tube. Once fertilized, the egg, now called a zygote, begins to divide rapidly, traveling down the fallopian tube towards the uterus. Upon reaching the uterus, the rapidly dividing cluster of cells, now called a blastocyst, implants itself into the thickened uterine lining. This marks the beginning of pregnancy. The implanted blastocyst continues to divide and differentiate, eventually developing into an embryo. Over the next several weeks, the embryo undergoes rapid development. Organs begin to form, and by the end of the first trimester, the embryo is considered a fetus. The placenta, a specialized organ that connects the developing fetus to the mother's blood supply, also forms during this time. The placenta facilitates nutrient and oxygen exchange between mother and fetus, while also removing waste products. The second trimester is marked by significant growth and development of the fetus. The fetus's organs continue to mature and it begins to move and kick. The third trimester sees the fetus reaching full maturity, preparing for life outside the womb. Labor, the process of childbirth, involves powerful contractions of the uterine muscles, gradually dilating the cervix to allow for the passage of the baby. Labor is typically divided into 3 stages: dilation, expulsion, delivery of the baby, and placental delivery. Section 5. Challenges in pregnancy. Understanding pregnancy-related complications. While pregnancy is a natural process, it's not without potential complications. Ectopic pregnancy occurs when a fertilized egg implants outside the uterus, typically in the fallopian tube. This can lead to rupture and internal bleeding, requiring immediate medical attention. Preeclampsia is characterized by high blood pressure and protein in the urine. It typically develops after 20 weeks of pregnancy and can lead to seizures, organ damage, and premature birth. Placenta previa occurs when the placenta partially or completely covers the cervix. This condition can cause bleeding during pregnancy and labor, potentially requiring a cesarean section delivery. Gestational diabetes affects how the body uses glucose and can lead to complications for both mother and baby. Preterm labor, labor that occurs before 37 weeks of pregnancy, is a significant concern.
Section 6. A window into health diagnostic procedures for the female reproductive system. Early detection plays a crucial role in managing and treating conditions affecting the female reproductive system. Pap smears, a routine screening test for cervical cancer, involve collecting cells from the cervix for microscopic examination. This simple yet effective procedure can detect precancerous changes, allowing for early intervention. Ultrasounds utilize sound waves to create images of internal organs. Pelvic ultrasounds can visualize the uterus, ovaries, and fallopian tubes, aiding in the diagnosis of conditions like ovarian cysts and fibroids. Biopsies involve removing a small tissue sample for microscopic examination. Pregnancy tests detect the presence of human chorionic gonadotropin, HCG, in urine. Blood tests play a vital role in assessing hormone levels and screening for sexually transmitted infections. Hysteroscopy involves inserting a thin lighted instrument through the vagina and cervix to visualize the inside of the uterus.
Section 7. Restoring balance, treatments and therapies for reproductive health. Numerous treatments and therapies are available to address conditions affecting the female reproductive system. Contraceptives, designed to prevent pregnancy, offer women control over their reproductive health. Options range from hormonal methods like birth control pills to barrier methods like condoms. Surgeries, while sometimes necessary, have advanced significantly in recent years. Hysterectomy, the surgical removal of the uterus, may be recommended for conditions like uterine fibroids or cancer. Laparoscopy, a minimally invasive surgical technique, allows for the diagnosis and treatment of various reproductive health issues. Fertility treatments provide hope for couples struggling to conceive. These can range from medications that stimulate ovulation to assisted reproductive technologies like in vitro fertilization, IVF. Hormone replacement therapy, HRT, can alleviate symptoms associated with menopause.
Section 8. Transitioning identities. The process of gender reassignment surgery. Gender reassignment surgery, also known as gender confirmation surgery, is a complex and deeply personal journey. This process involves psychological counseling, hormone therapy, and surgical interventions. The journey typically begins with extensive psychological counseling. Once deemed ready, individuals may begin hormone therapy to align their physical characteristics with their gender identity. Surgical interventions for transgender women may include orchiectomy, vaginoplasty, and breast augmentation. For transgender men, procedures may involve hysterectomy, metoidioplasty or phalloplasty, and chest masculinization surgery.
Section 9. Deciphering the code. Common abbreviations in reproductive health. Navigating reproductive healthcare often involves encountering medical jargon and abbreviations. Understanding these shorthand terms can empower patients to better comprehend their health and treatment plans. Let's decode some common abbreviations frequently used in reproductive health documentation. C-section, cesarean section, a surgical procedure to deliver a baby through an incision in the abdomen. HRT, hormone replacement therapy, used to supplement declining hormone levels during menopause. IUD, intrauterine device, a long-acting reversible contraceptive inserted into the uterus. STD, sexually transmitted disease, infections spread through sexual contact. PCOS, polycystic ovary syndrome, a hormonal disorder affecting women of reproductive age. IVF, in vitro fertilization, a fertility treatment where an egg is fertilized by sperm outside the body. Section 10. Your body, your power. The importance of reproductive health awareness. Understanding the female reproductive system is not just about biology, it's about empowerment. It's about equipping women with the knowledge to make informed decisions about their bodies, their health, and their futures. Reproductive health awareness empowers women to take control of their fertility, recognize early warning signs, advocate for their health, break down stigma. Openly discussing reproductive health helps normalize these conversations, breaking down stigma and promoting understanding. Section 11. A final word, embracing knowledge and empowering women. The female reproductive system, in all its complexity and wonder, deserves to be understood and celebrated. By embracing knowledge about our bodies, we empower ourselves to make informed decisions, advocate for our health, and break down the stigma surrounding reproductive health. Remember, knowledge is power, and when it comes to our bodies, we deserve to be in control. Let's continue to learn, share, and support each other on this journey of reproductive well-being.